My name is Kelly Batley.
My name is Clay Thompson.
My name is Neil Mowney.
We are MRHFM, a national firm with 70 attorneys and 11 offices across the U.S.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
At Bristol Myers Squibb, we believe that a single touch has the power to transform, to help make every day better, fuller, happier, healthier. So we are always working, proving that innovation and compassion work best hand in hand, developing clinical trials that better reflect the communities we serve, ensuring that every breakthrough reaches those who count on them the most, striving to change the world, starting with a single life. Yours.
At Novacure, we strive to extend survival in some of the most aggressive forms of cancer through the development and commercialization of our innovative therapy called Tumor Treating Fields. Novacure is pleased to partner again with the Meso Foundation.
Hi, everybody. Thank you for joining us today. We actually have a very special guest today. Her name is Carol. She is a mesothelioma survivor, and she is here to tell us her story. She has had many trials, many triumphs along the way, and it's definitely a very inspiring story to be had. So, Carol, I'll have you go ahead and introduce yourself, and you can kind of start at the point of where mesothelioma sort of came into your life.
Okay, great. Thank you for having me. My name is Carol Kirchhoff. I'm 63 years old, and I've lived in the Washington metropolitan area my whole life. I have 2 daughters and happily married for 33 years. My story began back in 2014. I was a runner, thought I was a pretty healthy person. Did other forms of exercise, and had a funny mole on my neck that I didn't like the looks of, and I was having some bladder issues, and it turns out that in March I was told literally back to back that you have bladder cancer and malignant melanoma. So kind of shocking, because I thought, how does this happen? All of a sudden, I'm never been in a hospital in my life except to have my daughters, and never been really sick. And all of a sudden I have 2 cancers. So in the search for when they went to remove the melanoma from my neck, they were trying to find what we call a sentinel node, which to see if the melanoma had metastasized. And in that exercise, they couldn't actually find the sentinel node. And the radiologist said to me, when you're done with all of this, and I know you have a lot on your plate, I saw something in your chest and I'm not sure what that was. So after you're all done here, check it out. So that, of course, threw me for the loop a little bit, and I wasn't quite sure what was going on, and tried to sort of stop the process and say, hey, I've got these 2 cancers and now there's something in my chest. Maybe we should take a pause. And we went ahead and did the surgery for the melanoma. They did find the sentinel node. It hadn't gone anywhere. Great news. Had my treatment for my bladder cancer. That was great. And in September, when I was all done with both of those, I went and had a PET scan. And I took all that information out to Mayo Clinic and said, what's in my chest? And I guess I was thinking it was one of these other two cancers had metastasized, even though they thought they hadn't traveled. And they said, no, you have mesothelioma, which I almost fell off my chair. Reason being is I had experience with this disease because my mother had passed away from mesothelioma. And that was in 1992. And at that time, we had no idea there was a genetic connection. And then, a few years before that, my cousin was actually diagnosed. Different areas, plural for me, but it was, and my mother, but his was in the abdomen.
Okay.
So, Mayo Clinic, which is a great institution, didn't have very promising information for me. They said, well, you've got probably 12 to 18 months, but the man that knows more about this than anyone in the world is in your backyard at NIH. So they gave me an introduction to NIH. At which
Can I ask you real fast, how did you get to Mayo Clinic? Did you do that sort of your own due diligence, or?
One of my very close friends happens to have a brother-in-law and sister-in-law at Mayo.
Okay.
And so she immediately, when I started telling her some of these things, she ran to them and said, what do you think? What do you think? And I will say, they said immediately, there's something bigger going on here, and she really needs to get her arms around it. So that's why when I finally had the pet, they said, get her out here, and we'll take a look at her.
Okay.
What's going on. So that's
okay.
what I put out there.
Yeah.
They gave me the intro to NIH.
Okay.
Where I have been since, so I quickly made contact. It was November. It was right around Thanksgiving, actually 2 days before Thanksgiving. And I started chemo in December at NIH, which led to a very significant surgery where I had the outside lining of my right lung removed, called a pleurectomy, and tumors removed. It was about a 6-hour surgery. And then we, we waited and watched, essentially. 2016, more meso popped up. I personally was of the decision that if you can take it out surgically, please take it out. So the surgeon went back in, took it out, and then lo and behold, 2017, another occurrence of the meso. I did not do radiation at this point, only because it seemed like, well, I had been told that once you radiate, doing surgery will be difficult. So knowing that I had possibly more surgery ahead, I held off on the radiation.
Were both of those recurrences, Carol, were they both on the same side as your original diagnosis?
Yep. And one was it seemed relatively quickly after the big surgery. I think they kind of knew it was looming, but didn't really present until 2016. However, in 2017, when they went in to remove the meso, they actually found something else that the surgeon was unsure what it was. So he began, slicing and dicing, and lo and behold said, you have breast cancer. And I thought, wow. And so again, kind of rug taken out from underneath me. So he had a great relationship across the street with Walter Reed, and I was accepted there as a breast cancer patient under a special exemption for non-military, and had quite a bit of more chemotherapy. And at the end had an axillary dissection where they removed the lymph nodes, and all were clear. So then again, I was faced with the radiation and thought, I don't want to take away this surgical option. So again, and because all the lymph nodes were clear, the likelihood of a metastasis was pretty low. And they said, if there's a reoccurrence, it'll probably be back in the breast. We can radiate then and address it. So I had that behind me. And in 2019, lo and behold, again, same side, meso reappears. There are probably like 5 little areas. And talked to a surgeon, and he said, we're almost afraid to go back in because we've been into your chest so many times. My pectoral muscle had been moved around to help repair the chest wall. And we're just kind of afraid we don't understand right now what your anatomy really is. And so I went into a trial that NIH was running. And I showed up actually to start, and some information came to light that I couldn't do the first part of the trial because of my recent breast cancer. So they said the second part of the trial is an immunotherapy, and we could try that. And so we tried that. It's pembrolizumab, better known as Keytruda, and started that in February of 2019. And in August of 2019, it was completely gone.
Wow.
So there was no evidence of meso. So, and I have been, knock on wood, clear of mesothelioma since August of 2019. I've been on Keytruda, however, I'm into my 5th year. So most people aren't on these immunotherapies for this length of time, and things kind of start to happen once you are. And so now I'm kind of going down that road of facing some attacks of my healthy system and trying to decide at this point what my next steps are.
Yes.
From
So
a
you're
medical
having
perspective,
some,
I'm extremely happy.
yeah, you're starting to have some of the side effects from the immunotherapy.
Some of the some thyroid issues, and actually some adrenal issues. Which
Okay.
become a bit more serious. So
Yeah. Okay. As far as your other cancers, does everything seem to be kind of stable at this point?
I did have a reoccurrence of the bladder this past November. I did a different treatment. I did a chemotherapy that was not systemic, but they actually put it into the bladder. And actually tomorrow morning I find out if that worked. So
Okay.
they'll be doing exploratory. So fingers crossed on that one.
Yeah, we'll be thinking about you and hoping you get good news on that one. So I know that you had talked about your mom had it, and then you had a cousin who was also diagnosed with it. And if I remember correctly, your brother also was facing mesothelioma?
My brother and another cousin, since my diagnosis, has had come up with it as well. So we have a genetic mutation called BAP1, which predisposes us to a lot of these cancers. So the melanoma, the bladder, the breast, the meso, ocular melanoma are all very common cancers that are seen with this BAP1 mutation. So my mother had one brother, and they both, we suspect, because they both passed away fairly young in their 60s. They both had the mutation. I had 3 cousins, all 3 had it.
Wow.
Two have meso. Well, one had meso, he's gone.
Okay.
One never had meso. He did have ocular melanoma. And then I have a cousin currently fighting meso. Then on my side, I have 4 siblings. So we all were tested. And one brother had it, the BAP1. My other 2 siblings do not. So
Okay.
the brother with the BAP1, he now is fighting meso as well.
Goodness. Okay. And as far as your sort of treatment history goes, when you had the chemotherapy prior to your surgeries, did you have the normal chemotherapy that's, the cisplatin and the Alimta?
Yep. That's what I had.
And as far as the surgery goes, I know you had the PD surgery. How would you say, I think a lot of the questions that I get from other patients are like, how would you say that that impacted your life or maybe changed your life at all? Do you feel like you were still able to do the things that you liked to do as far as kind of quality of life stuff?
Yeah, and believe it or not, I never went back to running. But I do still do an elliptical machine. I do a spin bike. I walk quite a bit. It's a daunting surgery. There's no doubt about that. It's a long recovery. But I think the most important thing, and my surgeon would come in, and I was in the hospital for probably 2 weeks. I had 3 chest tubes, one which stayed in, I even went home with it, but the lung the leak wouldn't go away. Although they said I had incredibly healthy lungs, this for some reason didn't want to repair itself. But the biggest thing he'd say to me is get up and walk. And the last thing I wanted to do was get up and walk, especially, with things coming out of my chest. And, I had my little, metal thing I had to walk along with all the bags. And, but he'd say, you're not going to want to do it, but you'll thank me for it later. And he said, your body, you need to move, you need to get things flowing. And he was right, because I would say that when I initially started walking after the surgery, I probably could do like a lap around the nurse's station and I'd be exhausted.
Yeah.
But each time I went a little further and I felt much better. So I think it was that encouragement. And, my husband would show up and he goes, okay, I figured out a mile is 9 laps around this floor, and encouraged me, come on. And we'd break it up. And so I think that really helped. And I think, my whole life exercising and doing things really helped as well. I mean, I would encourage, it's never too late to start something like that. But I would encourage anyone that thinks or gets diagnosed to be active. Don't do the opposite of what, because you want to sit in a chair and you just,
Right.
Yeah,
you don't feel good.
Yeah. And that's kind of my bellwether as I've gone through these last 9 years. As long as I can do these things I'm still doing, then that makes me really happy and it keeps me going. I think if I hit a point where, those go away, then it'll be a tougher battle for me. But
yeah, as far as the mesothelioma goes, I know you said that as of right now, you are in a remission state. What has the follow-up been like for you, being on the Keytruda? Do you get scans every couple months?
it was a lot more initially. So there was a time when I was having a CT scan every 9 weeks and a PET scan every 18 weeks.
And I would imagine that was when you were it was still part of the clinical trial, correct?
Yes. And then after I hit, after they saw 2 or 3 years of remission, then we started to back off. So I really don't have regular CT scans anymore. And I have 3 PETs a year.
Okay.
Still a lot when it comes to PETs, but.
Right. And the Keytruda that you're getting, you've been getting it every 3 weeks and almost for 5 years now.
Started my 5th year in February. So yeah.
Wow. And those treatments, were you getting those treatments at NIH? I know you said that's close to you, so.
Yeah, I was. And generally like my brother and my cousin, they, do it outside of NIH, but due to my proximity, they said, we can continue to do them here, which was great.
Yeah, absolutely. If there was something that you could tell a newly diagnosed person, something that you felt was very important, or instrumental in your sort of treatment scenario, what would you tell that person?
Well, the first thing I would tell them is do not go to the internet and start reading about everything, because that's frightening, not always accurate, and it's not necessarily your story. So I would do that, but I would educate myself on the disease and all of those aspects. But don't read the horror stories or the and then I would seek out, so the organization like the Mesothelioma Cure Organization, I think that's a strong organization that can help you manage your pathway. I don't think I know I didn't tap into that resource as I could have or should have, because I think it would have given me a little bit more direction. But I would get second opinions. I would look at trials that are out there to try to understand what the advances. I mean, there are advances all the time. The immunotherapy I'm on wasn't available when my mother was alive.
Right.
And I know today, as we speak, there are more and more things that are coming. So I would just be smart about educating yourself, finding out what's going on in the field and what they're doing out there. Make appointments at NIH, go in, or make appointments at Mayo, or wherever you're located. Just find out what's happening in the field and talk to the doctors before you panic, because it is a very frightening disease.
Yes.
I think for a long time, because, it was a disease where coal miners got it, or, it just wasn't that prevalent. I don't know if there was as much research and effort as I feel like there is today. And that's important, and that's encouraging.
Absolutely. Yeah. At what point in time did you find out about the BAP1 mutation?
It was fairly early on in my meeting with Dr. Hassan at NIH. I had actually, a couple years before, had a mole removed from my finger. And I had two dermatologists that said, it's really nothing, but if it bothers you, take it off. And I said, but I think it's changing. And they said, then take it off. So I had it taken off, and the biopsy traveled around to, I think it ended up at Harvard. And they said, we think this is melanoma, but it's not organized enough to call it that. But when I sat down at NIH, they said, well, that one was melanoma too, and that your genetic mutation actually presents some of these in a way that people don't recognize them for what they are. So it was fairly early on that I learned, and then it all started to make sense as to, my cousin and my mother, and
Right.
that.
Yeah, absolutely. As far as your siblings went, was it difficult for them to get tested? Kind of that unknown whether or not they had the genetic mutation or not?
Yes, not difficult in getting it done, but difficult in, and
understanding.
Yeah, well, and I don't think, I want to know, but I don't want to know. And
Yeah.
my siblings are all older than I am. And
Okay.
it seemed that this disease sort of shows itself mid 50s to early 60s. And at the time, most of my older siblings were past that, age, and they kept thinking, well, I'm safe. But they wanted to know, of course, because it means something in the generations below you as well. So they were very relieved. My two older, and then the one ahead of me, and interestingly enough, when he learned, he didn't at first react. So my reaction would have been, I'm going to go get scanned tomorrow. But what's hard out there is that people won't necessarily do that for no reason. So
Right.
to walk into, your primary care and say, I've got this genetic disposition and I want you to order a PET scan. Sometimes they'll do it, sometimes they won't, because, it's the whole, is insurance going to cover that? Why would they?
Right.
Because you think you might have something is not a reason to go through a test like that. So he waited, and his actually, I never had symptoms, so he had symptoms, and that's how he discovered. So he started to have shortness of breath. And when he went into the hospital, I remember his wife calling me and saying he had lung cancer. I said, he doesn't have lung cancer. He has mesothelioma, as sure as you and I are saying. And then on further investigation, they said, oh yeah, it is mesothelioma. So.
And does he live in the same area? Like, is he being?
He's in Baltimore, Maryland, so not too
Okay.
far away.
Okay.
But he did, I had made the inroads at NIH, so I got him in. He did have his surgery there. a bit longer than mine, a bit more complex than mine. And then he's gone more the route of the radiation. So he's had one other surgery, but mainly just radiation, and he's doing very well.
Good, wonderful. That's great. And at this point, you're doing pretty well too. You're feeling pretty good. And you are able to spend time with your family and do the things that you love, and just enjoy life.
Yeah. Yeah. I finally retired.
Good for you. Wonderful.
Yeah. I just didn't want to wake up and, regret it. So
Yeah. 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 I think, for us here at the foundation, one of the biggest things that we try to get people to understand is how important it is to get somewhere that really knows what they're doing with mesothelioma. So thankful that you had NIH in your backyard and that Mayo Clinic, ultimately got you there. So very good for you to, yeah, you had very good friends that got you where you needed to be. So that's great.
it is. Yeah.
Yeah, that's wonderful. Well, thank you for being here with us today. We appreciate this so much. I'm sure this will touch so many of our patients and give them so much hope, looking forward and knowing that hopefully there's some clinical trials out there and what we've got, that we're working on in the research. So
Great.
thank you. We appreciate it.
Thank you.